Hi, my name is Kara Friesen, and I am the Inspire Coordinator at Nationality Service Center. Today, I'm going to be highlighting a little bit about medical case management, what that entails, and who qualifies for these services. Navigating the U.S. medical system and the various state benefit systems can be overwhelming, given the various complexities and the requirements involved. For individuals who have complex health needs, whether it be physical health or mental health, medical case management can help newcomers navigate these processes while also teaching the client and their family members to become independent and managing these ongoing needs in the future. Programs such as Preferred Communities can provide intensive case management supports to qualifying Ukrainian humanitarian parolees. Preferred Communities, or PC, is an Office of Refugee Resettlement funded program that provides intensive case management services to qualifying individuals with challenging needs that require special attention. For example, supporting people who have long-term complex health conditions and therefore require medical case management. Here in Philadelphia, HISPA, Bethany Christian Services, and Nationality Service Center, which is where I work, each offer this specialized PC case management program that can work closely with clients with high medical needs to ensure they have access to benefits, specialized medical care, and are set up with other appropriate long-term supports. One thing I do want to note is that an individual is only allowed to be enrolled in one PC program. So if you and your family are already working with HISPA, you would not qualify for the PC program Inspire at Nationality Service Center. And this is something that we do check in with across these different agencies to make sure that we're not cross-enrolling anyone. When a client is enrolled in a PC program, they work with their case manager to identify several specific goals that they will work together to achieve over the course of their enrollment period, which is generally 1 year. I'll now share an example of someone who would qualify for medical case management and what those goals and services would entail. For example, if there is a 10-year-old with cerebral palsy who requires the use of a wheelchair and just arrived in the U.S. as a Ukrainian humanitarian parolee, this is someone who would be enrolled in medical case management, such as in the Inspire program. So the first thing we would do is ensure that the client is enrolled in benefits, including medical assistance, so that they can have access to health insurance. Then we would connect the client to a primary care provider, often one of the partners in our Philadelphia Refugee Health Collaborative. And that PCP would then assist with making referrals to necessary specialists for whatever the health condition may be. And we would have ongoing communication with the client or the client's family, as well as the medical providers, to ensure that there were smooth transitions with medical appointment scheduling and everything related to that. Because the child was in a wheelchair and transportation can be a challenge, we'd also likely assist the client with accessing mode of care medical transportation, which provides van rides to medical appointments for those who have medical assistance. We'd likely also apply for supplemental security income, SSI, if the primary care provider determines the individual's disability would qualify them for that disability income. And then because this child is school age, we would either assist with school enrollment, or if the client was already enrolled in school, coordinate with the school to ensure appropriate accommodations are provided related to physical needs. And then if there were any intellectual disabilities or developmental delays that also needed to be addressed. Those are just a highlight of some of the goals that we would assist with in a case like this. And of course, throughout this whole process, the case manager would work closely with the child's parents or other family members to help them understand these various systems that they'd be engaged with and ensure that they learn how to navigate them independently through the help of interpretation as needed moving forward. And of course, there are other supports that medical case management can assist with, and we are able to work with individuals of any age, from newborns up to those who are elderly. But each of those service plans and goals would be tailored to the client's unique needs, their health needs, their medical needs, their mental health concerns, and they can be addressed in detail through the referral and intake process in each of our respective programs. So if you or a loved one have a complex health concern and believe you would benefit from medical case management supports, you can call the NSC Newcomer Resource Line to inquire further.